those resulting from injury, this is the way I see it, from injury, surgery, or associated with severe infection, as seen in patients in an acute hospital setting, and those with pain in the back, neck, shoulders, and limbs of a psychophysical origin. The high incidence of the latter group has evolved into a public health problem of great magnitude over the past 40 years. It has been estimated that 80% of the population have a history of one of these painful conditions, which has led to the performance of a great deal of unnecessary surgery and the widespread use of pain medication. It is troubling to realize that the pattern of pain and physical examination findings often do not correlate with the presumed reason for the pain. For example, pain might be attributed to degenerative arthritic changes at the lower end of the spine, but the patient might have pain in places that had nothing to do with the bones in that area, or someone might have a lumbar disc that was herniated to the left and have pain in the right leg. More importantly was the observation that 88% of the people with these pains had histories of such things as tension or migraine headache, heartburn, hiatus hernia, stomach ulcer, colitis, spastic colon, irritable bowel syndrome, hay fever, and asthma. That's quite a listing. Eczema, and a variety of other disorders, all of which have been strongly suspected by physicians of being emotionally based.
In Healing Back Pain, The Mind-Body Connection, Dr. John Sarno introduces an innovative approach to understanding back pain. Contrary to common belief, he argues that back pain often stems not from physical causes, but from psychological factors, particularly Tension Myositis Syndrome, TMS. TMS is characterized by muscle tension and nerve irritation, which Sarno links to repressed emotions like anger and anxiety. He suggests that these emotions, buried in the subconscious, manifest physically as pain, used by the mind as a distraction from emotional discomfort. Sarno's treatment method centers around recognizing and addressing these repressed emotions. He educates patients about TMS, guiding them to explore and process their buried feelings, and encourages them to resume normal activities, challenging the belief in a physical cause for their pain. Psychotherapy may be involved to deeply explore emotional issues. The effectiveness of Sarno's approach is supported by testimonials from public figures such as Howard Stern and Senator Tom Harkin, who attribute their recovery from chronic back pain to these methods.
On a sad note, I want to say one of my heroes, my personal heroes, died over the weekend. His name was Dr. John Sarno. You've heard me talk about him many times. I've recommended to many people that they buy the book, Healing Back Pain, and his follow-up book, The Divided Mind, The Epidemic of Mind-Body Disorders. He died. He was one day away from being 94. Wow. I know he was on the decline for a while, and I've been missing him for a long time. What a wonderful, wonderful man. I suffered horribly from back pain for many years. It got so bad that even during the radio show, there were times I had to lay down on the floor on my back during the commercials.
Oh, it was impossible.
Impossible. And I was told by doctors I needed surgery and that I had all kinds of problems with my shoulder and a frozen shoulder caused by, some sort of weird defect and all this nonsense. And, I was close to getting operated on. Didn't know what to do. It was going out of my mind. And someone had told me about Dr. Sarno. And he he really saved my life. My life was just so racked with pain. The pain was unbearable. I mean, it was really bad. And because of him, I was cured. And
office over here. I didn't know it was that long ago. 1988, I had an episode with my back. Extremely painful. I was walking down the hallway right out here in the Dirksen building. And my pain hit my back so hard I fell right on my butt. Right out here. It's kind of embarrassing, I didn't know what was happening to me. It got a little bit better. But at one point, and I was working, and then the next year I was working on the Americans with Disabilities Act, of all things, as the chairman of the subcommittee of this committee, and I couldn't even walk back and forth. I had to put a cot over in the Capitol for me to lay on. Shortly after that, I had an MRI. They looked at the MRI and said, well, you've got a bulging disc causing you some problems. You should take an anti-inflammatory. So I did. Pain went away. About 3 years after that, this is in the mid-90s, again, I got back pains so bad. I was in Los Angeles. I was in a hotel room. I had to go to the bathroom. I couldn't even I had to crawl to get to the bathroom. I came back here, had another MRI. Well, still have a bulging disc, but there's this little hole down there where all your nerves go through. That's my layman's term of putting it. And that thing's not so, maybe you need to have that thing opened up or something like that. And, well, I thought about that for a while, and I dismissed it because my back pain went away. You know, after a while, it went away. But every time it would come, I could barely sit, I could barely stand, I could barely move. Painful. I even had a chiropractor come into my office once. I had to take a plane trip someplace. He had to work over my back so I could even get on the airplane. Actually, it worked. Chiropractic worked. Made me feel better anyway, long enough to get on the airplane. And then in 2004, I had another episode. And it was really bad. And I remember I was at the National Convention up in Boston. I could barely move. In fact, I couldn't. I curtailed my activities there. I came back. And that was my third MRI. I sent them up to the hospital for special surgery in New York to have them looked at. I wanted to get another opinion. Well, yeah, I probably needed steroid shots, and I needed to have that hole opened up, whatever that was. I had breakfast one morning with Mr. Ira Brind. He's the former chair of the university, Thomas Jefferson University Hospital in Philadelphia, just a friend of mine. And I told him I wasn't looking forward to this, but I'd checked with the doctors here, and they said I probably needed to have back surgery. In fact, one of the doctors had told me they had had back surgery, and they were fine. I really wasn't looking forward to that. So I told Ira, I said, yeah, well, I guess I'm going to have this back surgery, but it's been going on for all these years. He said, don't do it. He said, don't do this until I'm going to send you something. I'm going to send you a CD, and I'm going to send you a book, and read those first before you take any action. I got him the next day, sent him down the next day from Philadelphia. And it was a CD and a book by Dr. Sarno, Healing Back Pain. Well, I read this through, and I thought, you know, that sounds like me. That really sounds like me. And so I began to follow his regimen. That was in 2004. I haven't had a back pain since. I've never had any surgery. I've never had steroid shots or anything like that. I haven't had any back pain since. Now, that's not quite true. Every once in a while, I do get a little tinge of back pain, but I know what's causing it. I have the knowledge that I know what's causing it. Now, I'm going to expose myself here to this audience, whoever else is watching. Now, sometimes when I tell people this, they think I'm nuts. They say, well, what do you do? And I said, it's very easy. I talk to my back. And what I say is basically, I don't have cancer. I don't have anything wrong with my spine. I don't have any injuries. So therefore, it's coming from stress. Somehow I'm being stressed out. And my spinal nerves and stuff are being deprived of oxygen. And that's what's causing it. So what I need to do is ignore that. And I need to go about my daily activities just as though I was completely well. And when I do that, it goes away. I don't know that the IOM is looking at this. Now,
however, the medical community remains divided over Sarno's theory, primarily due to a lack of comprehensive scientific evidence. Critics argue that it simplifies the complex nature of pain and potentially overlooks serious physical conditions. Among the studies supporting Sarno's methods, Dr. David Schechter's research stands out. His study on chronic back pain patients practicing Sarno's methods showed a 54% success rate, indicating significant improvement in symptoms. Although this study offers some validation, It's often criticized for lacking control groups and standardized methodologies, which are crucial for scientific rigor. In addition to Schechter's work, another significant study contributing to this field is the randomized controlled trial conducted by Dr. Howard Schubiner. This trial explored the efficacy of a mind-body approach similar to Sarno's in treating chronic pain. It involved educating patients about the psychological origins of pain and teaching them techniques to address these issues. The results showed a notable reduction in pain levels among participants, providing quantifiable evidence supporting the mind-body connection in pain management. These studies, along with the widely recognized phenomenon of the placebo effect, highlight the complex interplay between psychological and physical health. The placebo effect, wherein patients experience actual health improvements after receiving a treatment with no therapeutic value, underscores the mind's power to influence physical conditions. Critics call for more rigorous empirical evidence to support Sarno's claims. While studies like those by Dr. David Schechter and Dr. Howard Schubiner offer some support, they are often criticized for methodological limitations. These studies, although indicative of the potential benefits of Sarno's approach, fall short of the scientific rigor typically required to alter standard medical practices. However, it's important to address these criticisms by acknowledging the complexity of pain. Pain is a subjective experience influenced by a multitude of factors, both physical and psychological. While Sarno's emphasis on the psychological aspects of pain has been revolutionary, a comprehensive approach to pain management should ideally consider both physical and psychological elements. While Dr. Sarno's theories on back pain have sparked controversy and debate, they have also highlighted the importance of considering psychological factors in pain management. The mind's influence on the body, as evidenced by the placebo effect, underscores the need for a more holistic approach to health that integrates both physical and psychological care.